is everything. These all studies caused big discussion, as Tom said, in Canada, one of the most affected countries, as Scotland also. And the Canadian Society of Interventional Radiology, in fact, recognizes the need for more effective treatment, and also they strongly support the urgent performance of high-quality clinical research. I think that many teams, as our team, we are doing in this direction to perform a well-designed and very well-done scientific randomized study in order to prove the role of the treatment and to prove the role of the CCA-SVI in the MS patients. The study of Dr. Zamboni was the first one that was showing very nice results after a balloon angioplasty and stenting in some cases, with some disadvantage about restenosis, so the vascular process can be repeated. And we have to work in the direction of maintaining, not only achieving, but also maintaining the vascular result in the time in order to maintain also the good clinical result. We are performing a registry in our hospital that is approved by our local ethics committee, and we have done until now, starting from February, we have done 461 consecutive patients with CCA-SVI treated by balloon angioplasty and stenting, and we have a very strict protocol for follow-up. And after having the 6-month follow-up for these patients, we are going to publish our results. What about the ultrasound color Doppler results of our study? In the beginning, we performed a randomized study of 40 healthy controls and 138 patients with MS, revising the presence or absence of CCA-SVI, of venous pathology of the truncular veins. What we have shown in almost 90% of the MS patients, we found they had venous pathology, and only 5% of the general population we have found presence of venous pathology in the healthy people. Healthy by neurology point of view, by MS point of view. But as I have said, this was in the beginning. If we perform again this study, we are going maybe find more in the MS group, because with the experience, we realize that the venous pathology is very versatile, and it's not only a stenosis like in the arterial bed, but in the case of the venous pathology, the pathology is congenital. It's pathology of the valves. There are additional membranes. There are pathologic valves, reverted valves, and so on. So with the experience, we discern more and more pathologic findings in the patients affected by the MS. Several examples. You see how compressed is here the vein at this segment, also here, and you see here a hypoplastic vein. In many of the cases, and mostly on the left side of the left jugular, we are finding almost totally hypoplastic vein that is absolutely not normal, and it's causing a huge elevated pressure into the brain, as Mark have shown also. Big impairment of the circulation. The venography results that we checked all these patients with venography, and we have shown very good matching between the venography that is the gold standard, the conventional venography, the gold standard of showing the pathology of the vein system. And the coverage between the ultrasound and the venography was very, very high. One example, as you see here, almost totally non-existing vein, hypoplastic vein that was shown onto the venography that is practically almost 100% occluded. and after the treatment this is the total restoration of the lumen and also very important of the flow. We performed a very exciting study that is also confirming the results that Dr. Hakish have shown about impaired circulation and oxygenation and blood gas exchange in the patients with MS. What was our motive, our assumption? First, the chronic inhalation of air with elevated concentration of CO2 and low concentration of oxygen, in fact, lead to symptoms that they are very similar to the symptoms that the MS patients are affected. Dizziness, headache, fatigue, impaired and double vision, cognitive dysfunction, dysarthria. In rest conditions, in healthy subjects, the oxygen tissue extraction and gas exchange doesn't differ significantly between the brain and other body regions, other tissue. And the immediate improvement after truncular vein angioplasty that we have seen in the beginning it was very difficult to be explained by the iron deposition reduction or something else. And because of that, we have thought about another very fast changing reason to have this fast improvement over the table, in fact, in some cases. So we assume that the chronic venous stasis leads to gas exchange abnormalities and that restoration of normal circulation leads to almost immediate gas exchange normalization at brain level and subsequently to fast neurological improvement. Our research included 108 patients with 30 controls and 78 patients with MS. So we examined samples of blood into the veins, into the femoral vein, and into the jugular and azygos veins. And we have shown that in the MS group there is a huge elevation of the concentration of CO2 and very low concentration of oxygen and desaturation. As shown here, there is a huge difference. You see, it's hypercapnia, so elevated CO2, hypoxemia, and O2 oxygen desaturation. That is very, very well shown. And compared with the control group, the healthy group, there is no difference between the jugular and femoral side. Sorry, there is no difference between the jugular and femoral side. You see here, no difference. Very small difference into the oxygenation and the saturation. And if compared both groups about the difference, we have shown that was highly significant, statistically significant difference in these signs. Just immediately after the treatment, we have shown that we had really immediate, mild improvement of the hypercapnia, also in the saturation and oxygenation of the blood. So, if we have to summary, compared to the femoral vein gas analysis in the MS patients group, the jugular vein gas analysis shows an unusual difference consisting of hypercapnia, hypoxemia, and desaturation. The jugular vein blood gas analysis in CCHDI is remarkable with hypercapnia, hypoxemia, and desaturation, with statistically significant difference compared to the control group. And the interventional treatment leads to mild, immediate reduction of the gas exchange disturbances. In fact, there are many questions about this study. We have to confirm in a bigger group in order to be absolutely sure. And it's very interesting, it's very exciting, and it's